the right amount of hormones in your body to keep you going. In production of some of these hormones, thyroid plays a major role that informs our body of how to use energy, and the use of this energy could either be high or low depending on the state of the thyroid, your thyroid. Today in the studio, we seek to look at the general role our thyroid plays in the functionality of our body and everything we need to know about thyroid disease. We're joined in the studio by Rotarian Nanajwa Kunedu Jani. She's the Deputy Director, Medical and Scientific Research Center, University of Ghana Medical Center, and she's also the founder and president of Thyroid Ghana Foundation. She joins us in studio. Good morning, ma'am.
Good morning, Deb.
How are you?
I'm good. Yourself?
Everything good? I'm fine. I'm fine. What is your take? You're in studio. You're talking about today's an F Wednesday, so we're talking fuel, we're talking fares and food. What are your views?
It's not been easy. It's not been easy at all, especially those of us who buy fuel, the fuel itself, and then those of us who go to market. It's like everything is skyrocketing.
So all the three F's is affecting you.
It's affecting everybody.
It's not easy. So how are you coping? How are you coping with it? How do you deal with it?
Well, we're just trying to manage through what you used to give out. Now you can't give out as you wish to.
Yeah.
So you have to keep it so that you can survive.
Right. Talking about survival, Nanajwa, you're a survivor of thyroid disease.
Yes, please.
And that's how come you started this foundation.
Yeah, sure.
Tell us your story. When did you realize you had? How did it? Tell us your story.
Okay, so in 2016, after birthing my last baby, we returned back home from the US, and I started being sick.
Okay.
He was just 4 months. I started realizing I was just losing weight.
Okay.
And that time I was working in one of the biggest hospitals in Ghana. So within 5 months, I had lost like 25 kg.
Wow.
And my foot was swollen. My muscles became weak. Along the line, I couldn't even get up to bath myself. So and they didn't know what was happening to me. I was moving from one consultant to the other. It wasn't clicking. Some of them get swollen, which we call the goiters. Mine, there was nothing on my neck. So it was a bit tricky. And I lost weight. I became very dark. So everybody was like, when they see you, they are like, what is wrong with you? Some people see you, they are not able to even see it's you. So one Friday, I met a friend, a doctor friend, Dr. Adjoje, and she was like, oh, Nanajwa, with all these tests that you've done, there's only one thing that is spiky to me. You have Graves' disease. And I had been in the hospital for 16 years. I didn't know what Graves' disease. I asked her, what's Graves' disease? In fact, my heart was really scared. Graves.
Yeah.
No. Then she was like, oh, it's a type of thyroid disorder. And that's what it is. So go and do the test. I did it, and lo and behold, that was what it was. So I started treatment and management, and I felt like my mother had died about 10 years earlier, and I felt like she had similar symptoms. So I felt probably that's what might have killed her. She was never diagnosed, so she died.
She passed on.
Exactly. So I decided to start a foundation after my surgery in 2018, and then I launched the foundation 3 months after my surgery.
Wow.
So I had my surgery in March, and the foundation was launched in July 2018. And this is where we are. We advocate, we educate the general public, like what we are doing now. So when you have something and you go to the hospital and there's no solution, prompt your healthcare professional. I've had something called thyroid disease. Can I be tested for? Probably, if that is what it is. And then we also educate the patients who have it. So we have a database of a lot of patients. As for the foundation, we do patient fora. We educate them on how to care for themselves, because about 90% of the care depends on you, the patient.
Okay, wow. It sounds very deep. It's an area we usually don't talk about.
Yeah.
So don't scare me, don't scare our viewers. What is the thyroid gland and what does it do?
Okay, so the thyroid gland is a butterfly-shaped gland right below our Adam's apple. So you know the men, if you are slim, when you raise your neck, you see there's this bone protruding.
Yes,
below the bone is that's where the thyroid gland is located. But you can't feel it with your hand unless it's not well, or it is enlarged a bit.
Okay.
So with that, then you can be examined and then it is seen. But some people, theirs doesn't get enlarged, though they are unwell.
That's the thyroid gland? What's shown on our screen now?
Yes, the red thing there, that's the
thyroid
thyroid gland.
Okay.
So it's and then it's also close to our vocal cord or our windpipe. So where it is very delicate. And what it does, it secretes a hormone called thyroxine, and that hormone is supposed to help your metabolism, your growth, the temperature of your body being cold and warm. It all depends on the hormone.
Okay.
So that hormone has to be produced at its optimum level so that you get the right metabolism for your system. So if it's not producing the right amount, or if it's producing too much, like how mine was, it means that your thyroid gland is sick and something has to be done about it.
Wow, it sounds scary.
It's not scary at all.
Okay, so does it present any symptoms?
Yeah, it does.
When should a person be concerned that, hey doc, can you check me for this?
Okay, so let's say, let me start with women. So I'm starting with women because thyroid disease affects more women than men.
How sad. Why does it affect more
women, we have a lot of hormones, right?
Yeah.
And because we are made of a lot of hormones, we are those that is too much affected. Men, we know we have hormones that help us to have our breasts come out. We have hormones for menstruation and all that. So that's why, how come it affect more women? Research have made us known that thyroid disease affect women because our hormones are divergently. Right. So that's the reason. But when it affects a woman, the same hormones also help. Can affect a woman, we are able to sustain ourselves, like how I went through. Probably if it was a man, maybe the person would have lost it, right? So in women, when you have a thyroid disease, if you're a woman and your menstruation is not too good, it comes, and some people will say, I've come across patients who are saying, oh, I know I'm not pregnant and my menses have not come for like 6 months. I'm not buying pads. I'm saving money. I say, you are sick, go to the hospital. Sometimes they go and check and their thyroid disease, they have a thyroid problem. Some people also, we lose our hair. So I lost all of my hair, so I had to start all over again.
So does it mean, Nanajwa, that if we now know there's a condition called alopecia, and almost every female who's losing hair is attributing it to alopecia, or probably the bonding glue for the hair. Does it mean then that it might be a red alert that hey, go get checked?
Go get checked, yes. Because not all of it that is from alopecia or the glue that we put on our hair, no. So if your thyroid gland is not, as I said, it's for your body metabolism. So how your brain functions, how your hair grows. Some people even get brittle nails. So if you're there and then your nails are so brittle, and sometimes it hurts when they press it, it hurts. And you are experiencing that, go check your thyroid gland.
For you, Nanajwa, what were your symptoms? What were your symptoms for over a period of? What was the period that you were going to doctors and trying to figure out what was wrong with you?
Almost 8 months.
Wow.
Before I was diagnosed.
Okay, and during these 8 months, what were the symptoms? So
I lost my hair. When I comb my hair, it comes from the strand. So you see the long hair on the floor. Along the line, they thought maybe it might be a cancer. So I did all those tests. I did a lot of tests. And then the other thing that I mentioned to the doctor who diagnosed me was I used to have on and off sore throat, and it won't get better. When I take the medication for it, it will go. When it's done in like 3 days, it comes back. So it was one of the symptoms. And also I started losing weight and I became very dark than how I was. I still didn't gain my color, but I looked better than when I was going through that. So if you are there, you're losing weight, you're not on any weight loss program, and you're just losing weight, though you are eating the food that you eat, please, you should have your thyroid checked to see if your thyroid is producing the right amount of hormone for your body to metabolize.
Okay, so we have some pictures of you during the period that you were dealing with thyroid. is going to come up on the screen now, and this is how Nanajwa was dealing with thyroid disease. Some of the pictures are coming up now.
You look surprised.
Yes.
Why?
Okay, so
is it because of this picture showing my?
Yes, I think when it comes up, then the picture that came up with the feet. Nanajwa says that was hair. There's another one.
I had that. So my foot was swollen.
This is
this one on the left.
The left.
Yes.
Wow.
Not the one with the eye, the other one. So,
okay.
So it's.
Did you feel any pain?
Yes, it hurts badly. It hurts, and then it's really painful. So sometimes it's so difficult for you to walk. That's why I said it got to a time even walking to the washroom was a problem. It was my husband who was supporting me. Right.
Okay.
So if somebody is suffering from it, you need family support. And you need organizational support. So there were times I couldn't go to work because I was in pain.
Of course.
Yes. Yeah. So I was off work for almost 5 months. And because I was working at an institution, my people understood me. But sometimes you get people, I had to go to their organization to talk to their bosses. Sometimes they say that, oh, she's just being lazy. I said, no. You knew the person. If you knew your staff and the person was hardworking and the person keeps telling you, I'm not well and I'm going to the hospital today, don't say that the person is being lazy. Find out what is wrong. Because I've had people, I had to go and talk to their bosses that the person had a thyroid disease. And having a thyroid disease, sometimes you wake up in the morning and you can't even move. Maybe the previous day you were just fine. So we call it as invisible disease. It just appears from nowhere. It's not like the day before you had a headache or something. Sometimes you are fine even in the evening before you went to bed. But you wake up in the morning and your joints are so hurting. You have joint inflammation that you can't even move. So it's not that the person is just being lazy or sick. So such a person needs support, needs institutional support. And this is what mostly is lacking in our part we find ourselves.
Right.
Because out there, people will ask you, are you okay? Is this, what can we do for you? But here, no. Oh, she's just being lazy. Every day she's sick. She's always saying, I'm sick. It's not everybody's will to say that I'm going to the hospital day in and day out. What do they gain to go to the hospital? Just to go and sit and wait to see a doctor? No. It's just that the person needs help. That's why the person go to the hospital.
Okay. Earlier when you started speaking and telling us how you were dealing with it, you mentioned that a lot of it depends on you and the support that you get. You mentioned that your husband was there. Using you as a case study, how did your children especially deal with it? How did your husband deal with it? How did your family, when you realized there wasn't cancer?
Okay, so when it wasn't cancer, everyone was happy. And then when we found that this was it, so the first thing was my husband was going to me to the hospital every now and then. So he was educated on it, and this is it. And then I had to see a dietitian who has also volunteered himself to see the thyroid patient, Frank. So he came to the house, told us the right food, what to eat, what not to eat, and all that. So that's why I said most at about 90% depends on you. Because if the doctor, what the doctor can do is to write the medication for you. If you go and you don't take it, it's up to you. If the dietitian says that stop eating this, and you say that no, for me, I'm an account, so fufu is what I like the most, so I will eat fufu every day, and the dietitian is telling you based on the test you've done that it won't help you, and you still eat it, it depends on you. It means that you don't want to get well. And a thyroid condition, let me say that, is not treated. managed.
Okay.
So you manage it for life. So I'm managing my condition for life.
Okay.
Though I've had a surgery, I'm managing it for life because I still get inflammations. And it depends on me to slow down when I'm stressed, because when you are a thyroid patient and you are stressed, you get inflammations.
Okay.
So it's up to you if you want to go and do it. And sometimes you have to be taking some medication for a long time. If you don't take it, you can get thyroid storm, what we could call thyroid storm, and you can just one day fall off, and it could be devastating. So that's why I say that 90% of the work depends on you as an individual, and also it depends on your family support, because the hospital bills are so much. Even before you can reach a stage where, like the type that I had, mine was overproducing. Okay. Before you can reach a stage where the levels will be optimum, alone is
okay. Which types of thyroid diseases are more prevalent in Ghana?
These days we are seeing all of them. At first it was the enlarged ones, the goiter, and then when the Ideated Health project was launched, but now you still see goiters. It's still there. You see people with enlarged. Mostly when I visit churches to do my education, sometimes I spot it and the person doesn't even know they have it. Yes. I spot it and I tell you, it looks like there's something growing here. Then I tell the person, raise your neck, swallow. And the person, sometimes even in my education grounds, I'm able to spot people and tell them to go and have it checked.
Okay, you mentioned foods. What kind of food should we eat, and which ones should we not eat to avoid this? Is it genetic too?
Yes, so some thyroid conditions are genetic, right? So if, like, now that I have it, and I think probably that's what my mom had because she was never diagnosed and she passed on. It means that, so every year when I'm doing the medicals for my children, I do it for them. But the genetic bearing sometimes is not direct, because some people have it, their children don't get it, and maybe their great grandchildren. So like we say that the genetic bearing is not all that direct, right? But it's genetic. So if it's in the family and you do your medical checks every year, please add it to your labs to see if maybe you have it. And also, those of us, we say that we should eat vegetables and fruit. One thing that the thyroid gland, the production of the hormone, contains three things: iodine, goitrogens, and selenium.
Okay.
Right? We get goitrogens from greens. So if you're getting goitrogens from greens, say you have it in your family and you eat a lot of greens, you are at risk.
Okay,
so too much of everything, they say, is bad. So don't eat too much iodine containing food. People say that we get iodine from salt. It's not only salt that gives us iodine. We get iodine from all seafoods. So all fish contains iodine. Crabs contains iodine.
Oysters?
All seafoods contains iodine. So it's not only from salt that somebody will say, me, I'm not eating the Adan salt, I'm not eating this, so I'm safe. No, nobody is safe, because so far as you're eating fish, you're eating iodine contained food. And we get selenium from nuts, like tiger nuts, granuts, almond nuts. All those things contain selenium. So you have to eat a balanced diet. That's why a dietitian will tell you need to eat a balanced diet. Don't say that, okay, I need to they say vegetables is good, or I need to keep my weight, so I'm not eating this, I'm eating only vegetables. No, vegetables can let your hormone go high, especially the green leafy vegetables, because it contains goitrogens. Okay. It can let the hormones go up. Okay.
Can thyroid disease trigger other illnesses?
Yes, it can.
Okay.
It can in that you say your body is the hormone is helping your body to metabolize.
Okay.
So if the hormone is not at its optimum level, sometimes it gives people eye problem, which we call the bulging of the eye. Sometimes you see some people, their eyes are protruding, right? And that can be something you'll be taking to the eye clinic until it's spotted that it's a thyroid eye disease.
Okay.
So that's one can. It can cause amnesia, because there's brain fog aspect of it, which
that's the bulging eye
eyes,
that showed
yes.
on my screen. Okay.
There's also a brain fog aspect of it, which can also let you get kind of amnesia. It can get you depressed. Depression is also another condition. And then all the some people too get hoarseness of the voice. So sometimes you see people, their voice is not, they are talking, but it's very
like sounds raspy.
Exactly. So that can also be an aspect of it. And then the swelling of the feet is also another, which we call edema. So it's also another condition. So thyroid comes in a lot of different forms. And it also affects babies as well. Some babies are born with a condition, which we call congenital hypothyroidism.
How sad. And okay, so if a baby is born, is it genetic?
So yes, some of them are genetic. Some of them too. It depends on what happened during the pregnancy. You know, like how the mother was going for an antenatal and all those things. The drugs, the food that they were eating. Some could be lack of some nutrients of the mother that could have that effect on the baby. So some babies are born and the thyroid gland is not working, or they are born and it's enlarged already. So in that unfortunately, those that are not enlarged, it can affect their brain development, and yes, it can also affect their growth. So we have some babies who have stunted growth, and sometimes we don't even detect it at that early stage, because in Ghana, it's not one of the things that we do, the test that we do. Out there, when a baby is born, there's this special paper that they take a blood from the foot of the baby, and they put it on it and they go and test it to see is the thyroid levels normal. But here we don't do it because it's
Okay, now talking about bills, we know about thyroid disease. You probably have the symptoms and you're going to get yourself checked. How affordable is the treatment, and is it on the NHIS?
Unfortunately, it's not on the NHIS because it's more than 150 cedis. The test is more than 150 cedis. So it's not on the NHIS. So you have to pay for it. And then if you are detected, the medication.
Hold on, Anajwa. So if I walk into a medical facility, say after watching this show and I feel that I have the symptoms, when I go for the test, request for the test, can I just go request for it?
Oh, you can go into any accredited laboratory facility. You don't need to really go and ask a doctor to write it for. If all the symptoms I'm talking about, you having some, you can just walk into accredited, all of these known laboratories, and tell them that I'm having these symptoms which was spoken about, and I want to do a thyroid function test, and they will do it for you. And that's it. Yes. So mostly we tell them when you get the lab, you can, the Thyroid Ghana Foundation, we have a website. You can pick our number, send the lab to us. We'll tell you if it's normal or is not. Or if you have a clinic that you visit, when you are going, go along with the report and tell the doctor that you were having these symptoms. You heard about that there's a thyroid condition. So they should check you and see if that is what it is. Then the doctor can interpret it for you.
Okay. And then, so you give support, your foundation gives support, okay? It's ideally, how much do you think it would cost for somebody to go through the process, treatment? How much do you think it would cost? And then you mentioned that there's aftercare because you still live with it and you deal with it. Is there medication that you take? How much does that cost? Or you have to go to the hospital every time?
Okay, so people that we have, the foundation, the people that we have in our database, we are able to support them because we have some pharmaceutical companies who donate the drugs that we take. And then when we are having our patient forum, we share it. Some of them too, we give it at the clinic, the hospitals, and then they share it to them. Currently, we are doing a collaboration with University of Ghana Medical Center because that's where I'm working. So I had to go and see the CEO, and then CEO accepted and management accepted that they would do a collaboration with us because we were seeing a lot of the enlarged ones. We also had a lot of patients who were supposed to undergo the surgery, and because of COVID, it was pushed. So we had a lot of backlogs. So we went to discuss, and from last year, 2021, they collaborated with us and they did it for 20 patients. And this year, too, they extended it. They are doing for another 20 patients at 1/3 of the amount, which is last year they paid 2,000 cedis. of the amount, and one fourth of the amount, quarter of it. And this year they are paying 3,500. You know, all medical supplies have gone up because of the dollar.
The
but we don't produce exactly. We don't produce any medicals. Most of them here, what the thyroid patient uses, we don't produce most of them in Ghana. So they had to take it. These pharmaceuticals companies, when they bring us the medication, like what you take after your thyroid surgery or when your thyroid hormones is low than the active one, that one is not expensive. That one is on the NHIs. That one is 35 Ghana cedis, and you take one box a month for life.
Okay, how do we find you? Is there a website? How do we reach you?
Okay, so the Thyroid Ghana Foundation have a website, www.thyroidghanafoundation.org, www.thyroidghanafoundation.org. The foundation has, so when you come to UGMC, you can find us because of the collaboration we are doing with UGMC. We are also collaborated with Akuma Production, and this we just launched Ghana Health Awards and Honors to award deserving health professionals, so that whatever money that is raised, we will be able to use it to support thyroid patients who can't afford the 1/4, but they still need the support. So Ghana Health Awards and Honors was also launched last week Wednesday, still at the University of Ghana Medical Center, and we are trying to raise funds to support thyroid patients who can't afford it.
We put the website out on our screens, and so thank you very much for coming, Nana Joa Kunedu, and sharing your story with us, and also setting up this foundation. So we've been having a conversation around thyroid disease, and we're joined in studio by Rotarian Nana Joa Kunedu Jani. He's the Deputy Director, Medical and Scientific Research Center for the University of Ghana Medical Center, and she's also the founder and president of Thyroid Ghana Foundation. So if you go onto the website, you find all you need to know about thyroid disease, and if you go on our Facebook, you can catch this whole conversation again and make points as to where you missed. And so that's our show. This is a special birthday message from Joe Afalate. He's a cameraman here at GBC to Chief Inspector, retired Togbe Hosu of Atadeke, and he's wishing you a happy 80th birthday. This is where we end the health segment. Coming up, we still have discussions on road safety during the festivities. We have a one-on-one with M. Tido, and then also headlines with a bearded gang coming up after this break.